Hello everyone, let's learn about the disease Mahasaushira. First, we'll go through the shloka. Sadaho dantamuleshu shvayaturjayate mahan jataha kafam shapayati kshine tasminastu shonitam. विवृद्धमनिशं दन्तान् तालोष्टमपि धारयेत् महासौशीर इत्येषः सप्तरात्र हिनस्त्यसूनः. The clinical features are a severe inflammatory edema with burning sensation develops on gums, and next suppuration, loosening of teeth from their sockets. Inflammation spreads to the surrounding structures like gums, palate, lips, which get roughened and cracked. Blood stained purulent discharge will be there, fever and pain in the mouth. And Dalhana has also mentioned that if the patient is ignored for a week, he may also die. So here the Mahasaushira is Tridoshaja dosha and it is Asadhya Roga. And the Mahasaushira is correlated with cancrum oris, which is also known as noma. So now we'll learn about cancrum oris. Cancrum oris, which is also called as noma, is a necrotizing condition which mainly involves oral cavity. So it is a rapidly progressive polymicrobial opportunistic infection which is caused by the components of normal oral flora that becomes pathogenic during periods of compromised immune status. This is the definition of noma. And now we'll know the etiology and the risk factors. The main etiology here are malnutrition, poor hygiene, and systemic diseases, which may include AIDS and HIV. And the causative organisms are Fusobacterium necrophorum and Prevotella intermedia. And next comes the clinical features. In the clinical features, it starts with a small ulcer of the gingival mucosa of which rapidly spreads and involves the surrounding tissue of jaws, lip and cheeks by gangrenous necrosis. And then the main features will be painful ulcers, foul odor and swelling. These are the main clinical presentations, and the stages of the noma are four. The first one is mucosal lesion, second is facial swelling, third is gangrenous plaque, and the fourth stage is scar tissue. And here are the few pictures of the stages. The first one is the mucosal lesion. The second is an example of the facial swelling. Third one is gangrenous plaque, and fourth one is of scar tissue. And next, the diagnostic approaches. Here the diagnosis will be mainly on the clinical presentation and on the patient history. By these we can find out the disease noma, which are mainly seen in the children. And the management strategies here are mainly antibiotic therapy, nutritional support and surgical intervention. Here the antibiotics mainly used are penicillin, metronidazole, gentamicin and clindamycin, and the surgical interventions here are excision, gingivoplasty, reconstruction surgery and removal of necrotic bone. Thank you.